Welcome to This Explainer. Today, we're unraveling a medical mystery that's quietly unfolding all around the globe. We're going to be looking at the progression, the risks, and honestly, most importantly, the reversal of fatty liver disease. Okay, let's dive right into this.
It's a pretty stark question to kick things off, right? Can simple fat cause cancer? We pulled this direct question straight from our clinical sources at Bolt Pharmacy, and it's something that's increasingly on the minds of patients and doctors alike. I'll give you a bit of a spoiler here. The answer is complex, but as you'll see, it's also incredibly empowering because you actually have way more control over the outcome than you might think.
To really understand why this matters right now, just take a look at these staggering numbers. We are looking at a truly global issue. In the UK, approximately 33% of adults, literally 1 in 3 people, have some degree of fatty liver. And mirroring this trend entirely on the other side of the world, data from Pakistan shows 25 to 30% of their population is affected too. So this isn't just some localized issue. It's a silent, massive epidemic spanning continents.
So how are we breaking all of this down today? Here is our roadmap. 1. The silent global epidemic. 2. Decoding the new names. 3. The pathway to cancer. 4. Factors driving the risk. And finally, 5. Taking back the wheel.
Starting with Section 1, the silent global epidemic.
So why do we call this a silent epidemic? Well, because for millions of people, this condition quietly does damage long before a single symptom ever pops up. Dr. Ghulam Abbasgil, who is a hepatology expert in Pakistan, points out a really alarming observation. They're actually seeing this disease in kids as young as 10 to 20 years old now. Why is that happening? It's largely driven by rapid urbanization. We're essentially trading active lifestyles for sedentary ones and swapping out traditional diets for highly processed, high-calorie foods. Basically, we're eating more, we're moving less, and our livers are paying the price by storing all those excess calories as fat.
Moving on to Section 2, decoding the new names. If you've been researching this on your own, or maybe you've recently looked at your medical charts, you might be totally scratching your head at the alphabet soup of acronyms. For years, doctors used the terms NAFLD, which stands for non-alcoholic fatty liver disease, and NASH. But recently, major global medical societies realized these old terms were kind of flawed. Non-alcoholic didn't really explain the root cause, and the word fatty carried a pretty heavy social stigma. So they updated the language. The new terms you need to know are MASLD, metabolic dysfunction-associated steatotic liver disease, and MSH. These new terms ditch the stigma and point the finger exactly where it belongs, at metabolic dysfunction. And sitting right above all of those specific terms is a brand new umbrella category, SLD, or steatotic liver disease. Adopted by organizations globally, including the Pakistan Society of Hepatology, SLD is just the broad, overarching term for a liver that shows fat accumulation on a scan, completely regardless of what actually caused that fat to build up in the first place.
Now, what's genuinely fascinating is how this new classification visually maps out. Under that big SLD umbrella, you can see how things break down. Notice that intersection where MASLD and ALD overlap. The medical community now officially recognizes that metabolic issues, like obesity and diabetes, often join forces with alcohol consumption to damage the liver. It's not always a strict either-or situation. These factors frequently overlap and compound the damage together.
Section 3. The pathway to cancer.
Okay, how does extra fat actually turn into something as dangerous as cancer? Let's walk through this timeline together. It starts with simple steatosis, which is just the initial accumulation of fat in the liver. For some folks, this triggers an immune response, leading to active inflammation, which we now call MASH. Over time, that constant grinding inflammation causes scarring, known as fibrosis. If that scarring becomes extensive enough, it turns into cirrhosis, severely disrupting how the liver functions. And it's really only in this highly scarred environment that cancerous cells are most likely to develop. The absolute key takeaway here is this. This is a slow, silent progression that generally takes decades. It does not happen overnight. But the link between that severe scarring and cancer is completely undeniable. According to Cancer Research UK and our Bolt Pharmacy sources, a staggering 80 to 90% of people who end up developing liver cancer have underlying cirrhosis. In fact, there's an annual cancer risk of about 1 to 2% in people with NAFLD-related cirrhosis. The heavily scarred environment damages DNA and causes rapid cell turnover, which basically creates the perfect breeding ground for genetic mutations.
But hey, let's take a deep breath here. As our clinical sources explicitly state, progression is neither inevitable nor direct. Most people who have a fatty liver will never, ever develop cancer. I want to really anchor you with this reassuring fact so you don't panic. The fat is a warning light on your dashboard. It is absolutely not a direct death sentence.
Section 4. Factors driving the risk.
So, what actually pushes some people down that dangerous timeline while others stay perfectly stable? Well, these are the critical risk factors you absolutely need to be aware of. Obesity, particularly abdominal fat, is a huge driver of chronic inflammation. Throwing type 2 diabetes, insulin resistance, or full-blown metabolic syndrome into the mix creates a highly hazardous environment for your liver. Combine those with drinking more than 14 units of alcohol a week, being over the age of 50, being male, or even having a viral hepatitis co-infection, and your risk of the disease accelerating multiplies rapidly.
Since we know the risks, a major question naturally follows. What are the actual warning signs that the liver is progressing down that dangerous timeline? How do you know if you're moving from simple fat to dangerous scarring?
The trickiest part of all this is that the early stages usually have absolutely zero symptoms. You feel completely fine. But as the disease advances into fibrosis and cirrhosis, the alarm bells really start ringing. You might feel persistent fatigue, a dull ache in your upper right abdomen, yellowing of the skin or eyes known as jaundice, or even sudden fluid accumulation in your belly, called ascites. And listen, if you have liver disease and ever experience severe symptoms like vomiting blood, black stools, severe abdominal pain, or sudden confusion, you need to seek urgent medical attention immediately, like call 999 level of urgent.
And finally, Section 5, taking back the wheel.
Well, let's not wait for those alarm bells to ring. Dr. Gill uses a really powerful analogy here that perfectly captures the current medical consensus. He says, you must sit in the driving seat. The treatment is not medicine, it's a change in lifestyle. Think about that. The doctor is just your navigator. You, the patient, actually control the initial reversal of this disease. For early-stage fatty liver, there is no magic pill you can just pop. Your daily choices are the medicine.
And the steps to take back control are incredibly clear. Step 1, lose just 7 to 10% of your body weight. That alone significantly reduces liver fat and inflammation. Step 2, adopt a Mediterranean-style diet, which means cutting out those processed foods and refined sugars. Step 3, get in about 150 minutes of moderate physical activity every single week to improve your insulin sensitivity. And Step 4, strictly limit your alcohol, or if you already have significant liver damage, just abstain entirely. This is the scientifically proven blueprint for reversing early-stage disease.
While you're managing your lifestyle day-to-day, your GP is going to be keeping a close eye under the hood. They'll run a regular FIB4 risk assessment using simple blood tests. If they need a closer look, they might order an ELF blood test or a fibroscan to measure any stiffness in the liver. And if someone already has cirrhosis, the standard medical care is a strict 6-monthly ultrasound surveillance to catch any potential cancer cells at their absolute earliest, most treatable stage.
Which brings us right to the end of our explainer today, and to a question I want to leave you pondering. Are you in the driving seat of your metabolic health? Fatty liver disease is a silent, global epidemic, sure, but it is largely preventable and totally reversible if you catch it early enough. Don't wait around for symptoms to appear. Take a hard look at your lifestyle, schedule a routine screening with your doctor, and grab that wheel. Thanks so much for joining me, and keep learning.